Dear colleagues, scientists, researchers, and potential delegates, I am pleased to announce that Abuja has now been selected to host the SPARC International Translational Research Conference in February 2026. It is expected to be a world-class convergence of minds and a rallying point of shared aspiration with both steps towards building the Africa we desire. This move aims to transform knowledge into solutions, research into practice, and vision into reality. Under the visionary leadership of President Bola Ahmed Tinubu, Nigeria has placed healthcare innovation and local content development at the heart of our reform agenda. The SPARC philosophy aligns closely with the Presidential Initiative to Unlock Health Sector Value Chain (PVAC). It will foster collaboration between government, academia, industry, and international partners and help lay the foundation for a homegrown pharmaceutical and biotech ecosystem. The SPARC conference and the embedded bootcamp will provide hands-on training and capacity building. It is not only timely, but intricately fit for purpose. Over the years, the promise of Africa's abundant talent, indigenous knowledge, and natural resources has remained underutilized. Despite our inherent potentials, Africa still grapples with health inequalities that are compounded by overdependence on imported medicines, vaccines, and technologies. By working together with SPARC at Stanford University, we aim to rapidly close the gap between scientific discovery and societal impact. Dear potential delegates, you will recall how during the COVID-19 pandemic, our inordinate reliance on external supply chains delayed access, cost lives, and slowed recovery. Global vaccine nationalism threatened access for many in Africa, highlighting the urgent need for a robust discovery to delivery ecosystem. However, embedded in every challenge is the possibility of a great and impactful breakthrough. In Nigeria, the current administration has chosen to respond not with despair, but with determination. The launch of the SPARC Nigeria program through this conference is therefore more than a national intervention. It is a continental call to reimagine how Africa can discover, develop, and deploy healthcare solutions. Dear colleagues, the conference and bootcamp in February will develop a nationwide framework that connects scientific breakthroughs with hospital works, policy frameworks, and communities. It will be an opportunity to train a new generation of African scientists, researchers, who not only publish in global journals, but also translate those findings into therapeutics, vaccines, drugs, diagnostics, products, devices, and processes that address our healthcare priorities. Let me emphasize, building translational research capacity is investing in our future. It is how we protect our people, safeguard our economies, provide jobs, ensure food and medicine security, and shelter our continent from the storm of future pandemics. Under my close supervision, the National Institute for Pharmaceutical Research and Development, NIPRD, continues to play a pioneering role in catalyzing contextual solutions for our people. From developing the National Plan for Vaccine R&D to spearheading phytomedicine verification during the pandemic, to convening platforms such as SPARC Translational Research Bootcamp and Scientific Conference, NIPRD's leadership demonstrates that when institutions are empowered, nations are transformed. At this point, I urge all research, innovation, and development-minded colleagues to robustly engage with NIPRD. Distinguished colleagues, as we count down to February, let us remember that this initiative is not for Nigeria alone. It is for Africa and indeed for the global community. Science knows no borders and disease respects no boundaries. Just as the global north must prioritize fairness, equity, and justice in its developmental agenda, so too must we in the global south unite to strengthen our inherent capacities. This is most sustainable pathway to global health security. As we prepare to host Africa and the world in Abuja, our ultimate aim is to achieve the following. 1. Establish Spark Centers in our universities and research institutes. 2. Train young scientists in world-class translational techniques. 3. Develop frameworks for knowledge sharing and policy reforms. 4. Build partnerships that translate into jobs, technology transfer, and improved socio-economic development. This meeting will be a turning point for Africa to take charge of its health ecosystem, and I want to especially invite you to join in the conversation transformative actions. I also want to invite senior policymakers, thought leaders, and stakeholders to join me at the opening ceremony of the high-level engagement. Please endeavor to visit the Spark Global and NIPRD website for further relevant information. Together, we can bridge the gap between scientific discovery and healthcare delivery, as well as improve health outcomes, secure our future, and strengthen our economies. Thank you and God bless.